welcome to have with us one of the newest physicians to Baxter Health. Been here about a year, but that's Dr. Arita. Welcome, sir.
Thank you for having me.
We're glad to have you. Vascular surgeon. Tell us about your experiences and why you chose Baxter Health.
Well, I was really attracted to the community here. This is not my first job as a staff surgeon, but we were looking to relocate, and one of the things that we were really drawn to Baxter was the community around Baxter. That really took us by surprise, and we'd like to see how well the community came behind the hospital. You can tell that it says a lot of things about the community, but also says a lot of things about the hospital itself to have the trust of the community. So that kind of won the trust in me. The administration also was a reason why we decided to move here. It seemed like a good administration to partner with. We both had the same common goals of trying to provide increased vascular care to the community.
You came from Miami, is that right?
I was raised in Miami, but I lived in Houston, I've lived in Tennessee, but we most recently lived in North Carolina, but most recently moved from Tennessee.
Mountain Home's a little bit different speed than those areas.
Yes, in a very good way. So.
Tell us about your specialty. Tell us about vascular surgery.
Yes, vascular surgery deals it's the care of your blood vessels that are outside of your heart. So typically we're talking about the arteries and the veins in your arms, your legs, the arteries and veins in your neck area, and also intra-abdominal blood vessels as well. So more specifically, we're dealing with problems such as carotid stenosis or narrowing, plaque buildup in your carotid arteries, plaque buildup in your lower extremities, and then aneurysms in your abdomen. Those would be the three most common things that we treat.
I got to listen to you speak a couple of weeks ago, and you talked a lot about an aortic aneurysm and the advancements that have been made and what you can do now as opposed to how that surgery was done 10 years ago. It was fascinating, but more importantly, it's so much more beneficial for the patient.
Oh, it's pretty incredible, and that is also one of the reasons why I chose vascular surgery. It is a field that really has embraced innovation and new technology, which translates to being able to treat patients in a more minimally invasive way, and also being able to treat patients that may not have been able to receive a traditional treatment in the past. Yeah. So we most certainly still do open surgery, but oftentimes we find being able to provide the same level of treatment through an endovascular means or minimally invasive way. So, but to your point, aneurysms in the past required large abdominal surgeries, long hospital stays, and really this almost the standard of care now has become trying to fix these aneurysms through small incisions in your groins. And typically, we have patients in the hospital for just one night, and they can return to their activities pretty soon afterwards.
I know you said you had a patient where you told him he couldn't lift anything heavy for a couple of weeks, but he ended up going to ride his horse the next day.
Oh, yes. I think I've had a few of those.
You work with different providers across the Baxter Health family and multidisciplinary. Work a lot in the cath lab, obviously. Baxter Health has just renovated one of our cath labs. It's state of the art. I got a tour of it the other day. It's pretty fantastic.
Oh, it's very nice. We're very blessed for being a small hospital to have all of the resources and infrastructure that we have already. So and yes, the cath lab will be, I think, a crucial component in being able to grow all of the heart and vascular services, because we have a growing cardiology team, we have a growing vascular team, and a growing cardiothoracic team as well.
We're really putting Mountain Home on the map in terms of cardiovascular care.
I think so.
We think about Mountain Home being a small town, north central Arkansas, rural America, but the opportunities that our hospital has for patient care, I mean, it's pretty phenomenal that we can do what we're able to do right here in Mountain Home.
Oh, absolutely. I don't think you would normally expect to have all of the, first of all, services and even equipment that we have at Baxter, and it's a smaller hospital compared to a lot of other larger hospitals that also, they probably don't have some of the resources that we have. So we're absolutely blessed.
Well, and to be able to attract a physician of your caliber, I mean, that's what it's all about. You have to have all those services and the equipment to be able to get physicians like yourself.
It's part of it for sure. I think the community is also part of it as well.
Let's talk about this area specifically in terms of our lifestyles. In the past, high smoking rates in this part of the country, of course, that is detrimental to your overall vascular health. How can you work with patients now who might have, had tobacco use in the past and now they're experiencing some of those cardiovascular issues?
Yes, that's something we see often here. We have an older population here, definitely. I think also in a region where tobacco use is very, very high. So, yeah, that's something that we just work through. It definitely increases your risk of having a lot of blockages throughout your arterial system, which can lead to different problems. So that's part of what we try to address when we meet these patients. So sometimes we have to jump straight to surgery. Sometimes it's just about controlling some of these modifiable risk factors and getting them to try to cut back, if not eliminate smoking, and implementing other lifestyle changes as well.
Are you seeing the same result in people from the high use of vaping now that we would see with tobacco use? Does that affect the cardiovascular system like cigarettes did in the past? Do we know that yet?
There's definitely some concern with vaping. I think there's even some concerns that vaping can be even more problematic, even when it comes to cancer risk. For my practice in general, because I am working with older patients, I don't see too much of the vaping, but there's definitely a concern. I don't think that vaping should be a substitute to smoking. I think smoking cessation should be a substitute to smoking.
What's the most? What patients do you see the most? What are the most common symptoms, most common issues that you see in your practice?
Absolutely. So our patient population is usually an older population. We're talking about if you're in your 50s, you're a young patient in my practice. Usually this is 60s, 70s, 80s, if not even in your 90s, right? The three most common medical problems that we see would be carotid plaque buildup, so carotid stenosis, lower extremity, peripheral arterial disease, or aneurysms. Now, in terms of your legs, the symptoms that you would see with peripheral arterial disease would be aching or burning when you walk. Now, that could be caused by other things as well, but arterial insufficiency could be one of those components. Or if you had rest pain or discomfort in your legs, even when you're not moving, and if that was consistent, that could also be a concern. It could be indicative of having a blood flow problem or a non-healing wounds. Now, again, there could be a lot of other contributing factors, but the blood flow should be something that gets evaluated. Now, in terms of carotid plaque buildup, a lot of that, most of the time, that can be more of a silent thing. Most people don't have any issues, but one issue that you can have is a mini stroke, and signs of mini stroke would be unilateral vision changes, speech difficulties, not being able to move your arms or legs, even if it's transient. That's where some patients sometimes don't seek care, as if they think, oh, I'm okay because the symptoms went away for after 3 minutes. No, that's still a concern, and they should get evaluated for it. Now, aneurysms, you really don't have any symptoms.
They're scary. You
right.
say the word aneurysm, they're scary to us.
They can be, and it's a life-threatening thing if you were to have a rupture. But there are some screening recommendations for anyone who has smoked in the past and older than 65 years old, and abdominal ultrasound can be helpful in identifying patients that have aneurysms that may not have known.
Yeah. They have a table right out front. You can sign up for the lung screening, and you can sign up for the cardiac calcium screening right outside.
Perfect.
There you go. And the lung screening, I heard that, they have appointments available next week.
Yes, that's the other thing in Baxter. Our services are growing, our bandwidth is really expanding, and our wait times, I think, are pretty reasonable, and we can get patients seen in a very timely fashion.
Well, we're so happy you chose Mountain Home. We're so happy you chose Baxter Health to practice medicine, and wish you the best of luck, sir.
I appreciate it. Thank you for having me.